Schizoid personality disorder, SPD, is a personality disorder characterized by a lack of interest in social relationships, a tendency towards a solitary lifestyle, secretiveness, and emotional coldness. SPD can be a precursor to schizophrenia, or delusional disorder. There is increased prevalence of the disorder in families with schizophrenia. SPD is not the same as schizophrenia, although they share some similar characteristics such as detachment or flattened affect. SPD is characterized by at least 3 of the following criteria: 1. Emotional coldness, detachment or reduced affection. 2. Limited capacity to express either positive or negative emotions towards others. 3. Consistent preference for solitary activities. 4. Very few, if any, close friends or relationships, and a lack of desire for such. 5. Indifference to either praise or criticism. 6. Taking pleasure in few, if any, activities. 7. Indifference to social norms and conventions. 8. Preoccupation with fantasy and introspection. 9. Lack of desire for sexual experiences with another person. People with schizoid personality disorder avoid relationships and do not show much emotion. Unlike avoidants, schizoids genuinely prefer to be alone and do not secretly wish for popularity. They tend to seek jobs that require little social contact. Their social skills are often weak and they do not show a need for attention or acceptance. They are perceived by others as humorless and distant and often termed loners. It is important to distinguish schizoid from avoidant. Avoidants will feel anxiety in social situations and have the desire to fit in, while schizoids simply prefer to be alone. It is occasionally difficult to distinguish between schizoid and Asperger's as well. This disorder is diagnosed more frequently and is often more severe among males. Schizoids usually do not seek treatment on their own and are often coaxed into it by a loved one.